Hello, I am Lisa Obradovic and would like to welcome you to the podcast Certification Inspiration, produced by the Wound, Ostomy, and Continence Nursing Certification Board, otherwise known as WOCNCB. Founded in 1978, WOCNCB is a not-for-profit professional international nursing organization certifying over 9,000 registered nurses who are specialists in the field of wound, ostomy, continence, and foot care. We are launching the Certification Inspiration podcast with a series of episodes that will discuss the different roles of a WOCNCB certified nurse, nurses sharing their own experiences. In this episode, you will hear from Jessica Simmons. Jessica is a nurse practitioner in a wound care and hyperbaric clinic based in Rockford, Illinois. She is also a certified wound ostomy nurse. In this episode, Jessica will discuss a day in the life of a nurse practitioner, CWON, at a wound care and hyperbaric clinic.
A day in the life of a nurse practitioner certified wound ostomy nurse at a wound care and hyperbaric clinic. Hello, my name is Jessica Simmons and I am a nurse practitioner at Swedish American Wound Care and Hyperbaric Clinics located in Rockford, Illinois. We are a hospital-based clinic and our hyperbaric center is contracted through Restorix Health. The population we serve covers our community in Rockford, Illinois, as well as multiple counties in northern Illinois and southern Wisconsin. Our clinic sees approximately 40 patients per day between clinic and HBOT, or hyperbaric oxygen therapy. On a daily basis, we are staffed with 2 APRNs, 6 RNs, 1 hyperbaric oxygen therapy tech, 2 clerical staff, and an additional APRN along with RNs to provide inpatient hospital coverage. We are a nurse-run, physician-supported clinic and also have podiatry, vascular, along with plastic surgeons who have scheduled hours in our clinic. I am certified through the WCNCB in wound and ostomy nursing and have been certified in wound care since 2009 and ostomy care since 2010. In addition, I'm a certified family nurse practitioner and dermatology nurse certified. I began practicing as a certified woundostomy nurse in 2010, working in the inpatient setting until 2015. At that time, I took a position in primary care, but it wasn't long before the draw of my passion for wound and ostomy care began to pull me back, and I left primary care for my current position. As a nurse practitioner, I am able to practice to my full scope. In clinic, I see wounds with etiologies that include pressure, vascular, neuropathic, atypical, and surgical. There really is no typical day, and the patients vary from room to room and hour to hour. We have 5 exam rooms, and the RNs will stay with the patient from start to finish of the appointment. The APRNs will move from room to room based on need, whether this is an initial visit, if the wound is deteriorating, or it's simply not progressing and it's time to change up the treatment plan. As an APRN, I will obtain a history and examine the wound. If further evaluation is needed, I will order the appropriate testing. Some testing can be done on site. For example, I'm able to obtain a tissue biopsy or can check microvascular status by checking a skin perfusion pressure. Often, we will manage the wound and direct treatments in clinic. If needed, I will order pharmacological treatment such as an antibiotic. In our clinic, we use more advanced treatments than what would be found in a primary care clinic. Besides advanced dressings, these treatments may include use of negative pressure wound therapy, contact casting, skin substitutes, and of course hyperbaric oxygen therapy. The APRNs will perform many of the advanced procedures, and if treatment beyond our scope is required, we will refer that patient to the appropriate specialist. Throughout the day, while patients are being seen in clinic, we also have a full schedule of patients who receive hyperbaric oxygen therapy. Many conditions we treat include osteoradionecrosis of the jaw, soft tissue radiation injuries which can cause conditions like cystitis, chronic osteomyelitis, and diabetic foot ulcers that are at least a Wagner grade 3. Before a patient is able to begin treatment, an extensive intake is needed, which consists of a thorough health history, physical exam, labs, EKG, and chest x-ray are all needed to ensure the patient is safe to dive. During the procedure, the HBO tech and the HBO director, who is also an RN, are in the room with the chambers directly monitoring the patients at all times. As an APRN, we supervise each procedure, and while we may not be in the room at all times, we are in the building and available if a need arises. Since barotrauma is a common side effect for patients that are beginning HBOT, ears are closely monitored for injury before and after procedure. If needed, the patient will be referred to an ear, nose, throat specialist for tympanostomy tubes. During a patient's course of hyperbaric oxygen therapy, we evaluate them for improvement of their presenting symptoms or monitor their wounds for healing. I developed my passion for wound care early on in my career. As a certified nurse's assistant, or CNA, and a nursing student, I would make a point to assist the nurses with dressing changes in order to learn. I joined my hospital's skin team and got to know the certified wound ostomy continence nurse. One day while working as a cardiac tele staff nurse, I asked her, "What do I need to do to have a job like yours?" She showed me the WOCN website and pointed me towards the education programs. She explained to me that additional education is needed in order to become certified. While wound care was my focus, she also told me to consider ostomy and continence nursing as well. It wasn't until I began my ostomy coursework that I really developed a love of this specialty that could rival my love of wound care. After completing my courses, I was able to sit for board certification and was super excited to have passed. I have been proud of my WOCN-CB certification since my initially certifying. Being certified helped me transfer from being a cardiac tele RN to a WOC nurse, since my employer would only hire a certified WOC nurse. I am seen as a go-to person for any of the wound and ostomy conditions, and I have the respect for my peers as an expert. My certification has given me recognition that I know my stuff within my specialty. I attribute a great deal of my career success and opportunities to being certified, and ended up joining the WOCN-CB as a committee member as a way of paying my good fortune forward. I continue to do this as a board member, and when asked by a nurse interested in how to get started in wound ostomy continence or foot care specialties, I direct them to the WOCN website, the education programs, and I immediately start the conversation about certification, just as one kind certified wound ostomy continence nurse did for me. I thank you very much for taking the time to listen to my story.
Thank you for listening. WOCN-CB sets the standard for wound, ostomy, continence, and foot care nursing certification by validating nurses' knowledge to provide safe, patient-centered care. Until next time, visit WOCNCB.org to learn more or contact WOCN-CB at info@WOCNCB.org. And remember to follow us on social media. This podcast is produced by WOCN-CB. Take care.